So apologies. Right, there we go. Excellent. Right, good afternoon, everyone. Welcome to today's press conference for the 20th of November. Good afternoon. Thank you for as always, for your time. Today we are joined on the panel by Lucy Whiteman, our Director of Public Health. We're joined by Becky Bradshaw, the Director of Estates and Campus Services at the University of Northampton. We're joined today by Debbie Needham, the CEO of Northampton General Hospital NHS Trust. We're joined by Councillor Jonathan Nunn, the leader of Northampton Borough Council. We're joined by Councillor Jason Smithers, Cabinet Member for Place, Highways and the Environment from Northamptonshire County Council. We're joined today by Superintendent Elliot Foskett from Northamptonshire Police. We're joined today by Dr. Joe Watt, GP Chair of the Northamptonshire Clinical Commissioning Group. And as always, we're joined by Paul Andrews from the NCC COVID Educational Cell. We're also joined today by Richard Auger, who's the leader of Daventry District Council, Councillor Tom Beattie, who's the chief, no, I was going to say chief executive. He's the leader of Corby Borough Council, and Councillor Martin Griffiths from Wellingborough Borough Council, who's the leader there. Apologies, I got tongue-tied there, I do apologise. So today we're going to, the running order will be Lucy Whiteman first with her update of the figures, and then we will go to Deborah Needham, then to Joe Watt, then to Councillor Jason Smithers, then to Elliot Foskett, then to Becky Bradshaw, to Councillor Jonathan Nunn. So we'll go straight away to Lucy Whiteman, our Director of Public Health, to update us on the figures this week. Good afternoon, Lucy.
Good afternoon, thank you, Councillor Morris. What I'm going to do is give a bit of a brief overview today. Obviously, people have got the report to peruse at their own leisure. But we've got a lot to talk about today. There's been a lot of progress this week, lots happening in the system that we want to obviously give you an update on. So if we start to share the slides, please, if that's possible. There we go, and if we can just take that into a slideshow. Thank you. So obviously the key headlines here. So very similar week to last week. Unfortunately, another 1,600 cases, so 1,642 to be exact. So, you know, obviously we understand that we haven't started to see the full impact of lockdown yet, but this clearly just demonstrates the severity of the virus locally and still the height of the level of community transmission. So, you know, really concerning that second week into lockdown, we're not seeing a bend in the trend yet. We're hoping, obviously, that the effect of lockdown will start to filter through the numbers next week, but it just does demonstrate quite the level of community transmission, as I said, that we're going to be battling against over the next 2 weeks. So cases will continue to rise unless we adhere to those national guidelines and utilise this circuit breaker to obviously get Northamptonshire in a better position. And obviously from the information that we gather from all of the cases and their contacts, the lion's share of the transmission is still within the community. It is that contact between household members, and again, it's that previous contact between households. So again, just reinforcing the opportunity that we've got here during the lockdown period with the restriction between household contacting, that we can utilise this to help bend this trend. If we go on to the next slide, please. This is just really a stark reminder of the fact that the advice at the moment, in fact, the national legislation at the moment is around staying at home. So only going out for those compulsory journeys to take people to school if necessary, to work if you're not able to do so from home. And obviously for essential medical exercise and food reasons, nothing else. If we go on to the next slide. And that's because, you know, at the moment we are still seeing that significant increase in the rate in the over 60s. You know, since a few weeks ago when schools went back, we've seen the rates domino through the different age groups, and now we've got that older, more vulnerable population at significant risk, and that is translating day in, day out into increased number of cases presenting at our acute trusts. So one of the ammunitions, one of the tools that we've got in our toolkit to help reduce pressure on the NHS is to make sure that those that have been invited for their flu vaccination do take up that opportunity, keep that appointment, and obviously go and get that flu vaccination when it's made available to them. And we're just really taking the opportunity again to reinforce those key messages. We can't allow people to become complacent over this period. There is still a very high level of circulating virus in Northamptonshire. We must start to, utilise this time to restrict our movements. And obviously where we are having to go out for those essential trips, making sure that we continue to maintain space, that obviously we continue to cover our face, and that we continue to wash our hands and reduce that risk of taking COVID home to our loved ones. If we go down to the slide number 5, please, so we'll start to look at the data in a little bit more detail. So you can see almost an identical week to last week. So, that last hurrah before lockdown, having that big jump in our numbers, and that's been maintained. So really concerning, a sharp rise still as a trend, and something that we obviously have got a lot of work to do to get on top of. If we look, as I was talking about on the next page, about how that breaks down across the different age groups, again, still a big female bias, which I know was mentioned actually in national news today. But you can see that real bulge now in the working age group, and the numbers translating into higher and higher numbers of cases in our older adults. We go down another page. So the rates and numbers in each of our boroughs and districts, a small change and reduction in East Northamptonshire and Northampton, bearing in mind they've been the 2 areas with the greatest numbers in the last couple of weeks. That's starting to be good news. But, 1 week's data change is not a trend. We need to see these persistently coming down. And we've got 5 boroughs and districts overall that still have had an increased number of cases in comparison to last week. So if we compare that in the next slide as trends, you can see that obviously Northamptonshire is now, as a county, a trend that is much closer to the England trend. And indeed, we've got Northampton that's overtaken the England average rate as a borough, and we've got Wellingborough that is very close to doing so as well, although we've seen a slight improvement in the numbers in the last couple of days. But the rapid and steep escalation in our cases locally has gone against that national trend, and we're now in a position where we are comparable to that position in a number of our boroughs and districts, and that's extraordinarily worrying. If we go down to the next slide. So, you can see there Northampton is statistically significantly higher as a borough compared to the county rate. And there's only Wellingborough now that's a little bit lower, and that's because we had a huge amount of focused work there a couple of weeks ago when their cases really escalated. We've now got Northampton as well, as I said, comparable to the England rate, as well as Daventry. Now that, we were miles behind the England average rate a couple of weeks ago. So again, that just demonstrates how rife the virus is still in our community, and how at risk, particularly our vulnerable groups and our over 60s are. So more has got to be done. We've got to be more compliant. We've got to be more adherent. We've got to be more conscientious. If we go down to the school situation, so one of the good news stories is the fact that we've managed to maintain a pretty static position, although case numbers, as you can see, have started to go up a little. The number of schools has remained relatively low compared to other areas, but for each outbreak within a school, you can see it affects a lot of students and teachers. So those are people that obviously having to then potentially miss educational opportunities, having to learn online, which can be challenging for some, and so has a significant impact. We need to reduce the community virus onward transmission rate so that we can protect these people's education. The university has done a brilliant job, and we want to sort of congratulate the students and the school, the university and the staff body for being able to maintain that position. Again, they've demonstrated some brilliant behaviours. But again, it's one of those areas that we've still got a long way to go, and Becky will be talking about a programme of work that's starting to make sure we can get students safely home for Christmas. But we have got 99% of our schools open, but the impact of that additional circulating virus in the community has meant that our pupil attendance is now down to 86% as compared to 94% this time last year. So, some challenging times for schools, despite all their good work. If we talk about the general position for other outbreaks in the county, we head on a few more slides. Thank you. So you can see a marginally improved position locally here, where there are currently 58 active outbreaks. Again, you can see they're sort of scattered across the county and across different settings. Good news is they've significantly reduced in hospital and healthcare settings. And obviously that's really important as those services do start to feel even greater pressure going into winter. You know, one of the areas that we obviously still work very closely with is the schools cell, the Department for Education and Public Health England, to help manage and maintain schools as a safe setting. But the other good news is obviously outbreaks in workplaces have started to decline. Again, that will be quite likely the very beginnings of the effect of lockdown, where people started to work from home. So in summary, obviously, we're very much not out of the woods. We've still got a long way to go, and we headed into lockdown with a very significant upward trend, which always meant we had a lot more ground to recover. The translation into hospital admissions is a real concern. So it's about protecting those over 60s at the moment, those that are more vulnerable, those that are in the old shielding groups, and making sure that obviously we adhere to those rules, utilise this time, and hopefully come out of the lockdown in a better position.
Thank you very much, Lucy. Some key messages there, definitely. And we have to do what we can to reduce the infection rate in the over 60s. And we all take responsibility for that. I'm going to pass now to Deborah Needham, who's kindly joined us from the Acute Trusts. Hi, Deborah.
Hi, thank you, Councillor Morris. So within the acute trusts, we are seeing a steady increase in the number of admissions due to COVID, and we don't expect that that will peak until probably next week. So this means that everybody needs to remain vigilant against this really infectious and potentially devastating virus. We've currently got 133 patients who have COVID across both of our hospitals in the county. So staff at both hospitals are working incredibly hard. I can't begin to tell you how hard the staff are working at the moment. And as we start to face the rising COVID patients, along with the expected increase in admissions as we go into winter, that will of course become more and more difficult. I think it's fair to say that we learned quite a lot about the disease during the first wave. So we're in a better place to treat it. We have continued to maintain our COVID and non-COVID areas and treatment pathways within both organisations. And that's much more improved than it was in the early days of the pandemic. So because of that, we're able to keep our patients safe. Our winter planning that we have in place allows us to increase our capacity. And we will do that as we go through winter. So the message there is, if you need us, we are here for you. But I would just like to remind the public that our A&Es are here for urgent and immediately life-threatening cases. So please use other avenues if you possibly can. As you are aware, we have been determined so far to continue with our planned care, with a focus on cancer and urgent treatments. This week, however, we've had to postpone a number of outpatient clinics at Northampton General specifically, and I would just like to let everybody know that that may continue or even increase over the next few weeks as we start to get busier in both hospitals. My main message on this part is if we do have to postpone your appointment, then we'll contact you directly. So if you don't hear from us, then please do attend your appointment as originally planned. So as a reminder, please do all that you can to keep safe. Please stick to the rules, advice and guidance. We need to reduce the spread of this virus. So in particular, wash your hands regularly, continue to wear your mask, maintain social distancing and reduce contact with other people as much as you possibly can. Also remember, it's important that you choose wisely with regards to seeking medical help. So consider the alternatives such as NHS 111, contact your GP, get some advice or support from local pharmacies as and when you need that. A&E is for urgent patients and life-threatening patients only. So I'll stop there and I'd be happy to take questions at the end.
Thank you very much, Deborah. Again, the key message there is we've got to do what we can to protect the over 60s and prevent them catching this virus as best we can. And it, again, is down to all of us to make that happen in the way that we behave, as you've outlined in your message there. Thank you very much. I didn't say at the top that we would go to the written questions at the end, but that is what we will do as we normally do. So I'm sure Deborah will come back in at some point. So we're going to come on to Joe Watt next, and a key message here has to be about the over 60s, again, getting their flu vaccination in order to protect them from the double whammy of flu and COVID. But I'll pass over to Joe. Welcome, Joe, and thank you. I know you're very busy.
Thank you. So I really just wanted to emphasise that those people who have been invited for flu jabs, it is really important that you get those, and that will be the over 65s, people with long-term health conditions, those who are pregnant, those people who have carers allowance. The new group this year is somebody who lives with someone who was on the shielded patient list, as well as the shielded people themselves. Health and care workers and carers, and junior school aged children. So those are the groups, and you should already have received an invite. As long as you are registered with a GP, you will have received an invite. Some of the vaccine supplies are a little bit slow coming through, but if you have received an invite, then you can contact your GP surgery to book that appointment. As I say, it is really important that you get protected. It is something that we could do now that makes a really big difference. And even if you haven't had the jab before, it would be a good idea to do that. There have been a lot of questions, particularly in the press today, about the over 50s who are not in any at-risk groups. And it is unfortunate that that has arrived a little prematurely in the press, because we are making plans for that, but we are not quite ready. So if you have not been contacted by your GP surgery, my message would be wait. As long as you are registered with a GP, when you are eligible and when the vaccine has arrived, you will be contacted, you will be called into clinics to make sure that you can get your vaccine, but we're not quite at that point yet. So I would urge people, please don't clog up your GP surgery lines if you are over 50 but not normally invited for a flu jab. We will contact you, but please don't use up the capacity from that point of view. And certainly our local medical committee is a little bit disappointed that practices haven't had an opportunity to prepare, but they are getting prepared. They're getting those orders in, and we will make sure that you're protected once we've got everything in place. But essentially the message is protect yourself. If you're pregnant, please do protect your baby, and make sure that you get those vaccines. They are the same vaccines that we've been using for years. They might cause a slightly achy arm, but other than that, they're pretty good. And obviously for children, it's the nasal squirt, no needles. So if you've been called, do get in touch. As I do, to keep your appointment. You've probably already been offered an appointment, but keep those and be patient if the vaccines are a little bit longer coming through. Thank you.
Thank you very much, Joe, as always. I think the key message there is be patient with the flu jab. We will get round, or the acutes and everybody else, and the doctors will get round to delivering those to the people that need them. But at the moment, we need to concentrate on the 60 and 65 plus category who are obviously at more risk from COVID-19. I'm going to bring in now Councillor Jason Smithers, who's going to talk to us about what we can do to stay more COVID-19 secure whilst using public transport and travelling generally. Councillor Smithers, hello, sir.
Thank you, Councillor Morris. Yes, so really, I'm just really reinforcing some of the messages that are already out there. So, you know, really, you must stay at home and avoid travelling unless you really need to leave home for work or essential shopping or school runs. And if you do, just ensure that you comply with the COVID-19 safe behaviours at all times as well. You know, especially on public transport, when on buses and at bus stops, and when car sharing to and from places of home and work, or to school, or to go shopping. Because really, this is when you're at most at risk of transmission or catching the COVID-19 virus. So it's vital that you wear your face mask and use hand sanitizers and wash your hands regularly. And remember to try and keep a safe distance at all times. If you practice these behaviors constantly everywhere, you really will minimize your risk. So moving on to sort of car sharing. So if you are car sharing, then you must not share a car with someone from outside your household, really, or support bubble, unless your journey is undertaken for exempt reasons. For example, if car sharing is reasonably necessary as parts of your work. It's, as you all know, very difficult to socially distance during car journeys, but there is ways that you can reduce the risk of transmission if you are sharing transport with the same people each time. Also minimise the size of the groups that are travelling in your car. And open the windows, a little simple opening up the windows to allow ventilation. Travel side by side or behind other people rather than facing them, where seating arrangements allow, obviously. Facing away from each other. Consider seating arrangements to maximise distance between people in the vehicle as well. And also clean your car in between journeys inside using like standard cleaning products which are available from all the leading supermarkets. Make sure you clean your door handles and other areas that people may touch as well. And ask your drivers and your passengers to wear face coverings. Face coverings are the secret to stopping the spread of this as well. So whilst out and about on your journey, if you do need to stop at a garage, petrol station or motorway services, try and keep distance from other people, and if possible, pay with contactless methods, because again, touching PIN terminals, is really a no-go. So if you can use contactless, please do that. Follow all the guidance for the use of face coverings where possible, and also use the NHS COVID-19 check-in app at any venues that you go to. You usually find a little QR poster at the entrance. Alternatively, you can provide your contact details if need be as well. Remember, wash your hands and sanitize them as you re-enter your vehicle. Now, on public transport, you need to sort of think about this when you're finishing your journey. Get your sanitizer out your pocket or out your bag and give your hands a sanitization with an alcohol gel or anything that will suffice. Also, when using public transport, plan your route and decide how you're going to get there. Make sure you have enough time, because it might take a little bit longer than normal because of social distancing. Try to travel at quieter times if possible. If you normally need help to travel, contact the bus and train companies. They will still be able to give you this help and advice. And it's a good idea to buy your ticket online if this option is available to you before you travel. Again, and if you can't do that, try and use contactless payment. So it's all about minimising the risk. Other things to remember when you travel: always wash your hands before and after you travel, or use hand sanitizers, as I've said. And again, remember to wear that face covering. If the police ask to see your face, just to check to see who you are when on public transport, you should take off your mask and allow them to see you. Try to make sure that you're social distancing at all times at bus stops, on train station platforms, and where possible on all public transports. Remember the space message there. Sometimes you might have to be close to people. For example, when you're getting on and off the transport, if this does happen, try not to touch anyone unless they're your carer or they're in your bubble. Face away from people if you can, and move away from them as soon as you can as well. And again, keep the face covering on. So when you're on a bus or a train and you're coming up to your destination, try not to touch things like windows, doors, hand railings and so on, unless you really have to support yourself as you're walking through the vehicle. And listen to what the transport staff have to say. They will tell you things you need to know, like what seats to use, how to queue safely, what doors to use, and so on. If you do use transport, it's very useful to ensure that you have that sanitizer, ensure you've got that mask on. And if it's busy, if the train comes along or the bus comes along and you can wait, do wait for the next train, because it may not be as busy. Now, a lot of our travel company, bus company partners locally have put more services on and increased more services through our busy routes and at peak times to help with this as well. So it's worth bearing that in mind. So certainly do not eat and drink on public transport as well, unless you really need to. And if you start to feel unwell, and you should inform a member of the staff straight away. Now, I think this is quite important to get across, and if you do travel on public transport and you think you've got coronavirus, certainly do not travel. Do not go out onto public transport if you think you have it. Do not travel if you're someone in your household with you has coronavirus. Do not travel if anyone in your support bubble or has coronavirus, they think they have it. Do not travel if you've been told to shield as well. And the question I'm asked a lot on a regular basis is about children, and children on public transport. If you travel with children, you need to help them follow these rules too. It's important really, because children, are exposed to this and can spread it as well. So children under 3 years old should not wear face coverings. It's pretty unfair on them. But children of 3 to 10-year-olds, if you can get them to wear a face covering, please do. It will help the situation. And if they can wear it, encourage them to. And finally, remember the key messages are wash hands, cover your face, make space, and together, by following these simple rules, we will beat this together. Thank you, Councillor Morris.
Thank you very much, Jason. Very good advice there. And the main one being avoid travel if at all possible, I think. And to don't get complacent about taking COVID-19 home with you, I think is probably a very key message. I'm going to bring in Superintendent Elliot Foskett now to probably reinforce some of those messages that Jason just gave, and to also give us some key updates from the police. Good afternoon, Elliot.
Good afternoon, Councillor. Good afternoon, everybody. Yes, just really quickly to reinforce some of those. I don't intend to go over them all again, but just about the essential travel, about leaving your house. I'll come back to the message that I gave, I think, last week, which is don't do it. If you don't need to do it, don't do it. Think about the action you're going to take. If it's going to potentially increase your chances of getting COVID or even passing on that infection, then you shouldn't do it. Just minimize the time that you're spent out of the house. And when you do go out of the house, folks, wear a face mask. The law is very, very clear about when you have to wear it. I think that the one thing that we've seen a real shift in really is at the start of this lockdown. What we found was you would see people out and about in shops without face masks on. I think it's become more obvious now that people aren't wearing them, or because the majority of people comply with it. You'll go into a shop and it's far more noticeable if somebody is not wearing a mask these days. Please wear your mask. That's what it's there for. Also, I think I just wanted to mention very briefly about the importance of children and parents understanding that you shouldn't mix outside of school. Yes, kids go to school, kids are in a bubble. They understand that the schools are trying really hard to minimize the spread of the infection. But please don't be taking your kids on play dates around somebody else's house. It's against the law. We're not doing that. We shouldn't be doing that. Do not mix. Keep to the restrictions that are in place and protect yourselves, protect your family and your extended family. A couple of updates from us. I guess we've seen around about a 25% reduction in the amount of traffic on the roads in Northamptonshire, which is good news. Clearly, we would want to see less journeys being made, but clearly not anywhere near what we saw at the start of the first lockdown, but still a good amount of reduction. We continue to see good levels of compliance overall, and we continue to issue fines to people who continue to break the law. If the laws, actually remembering, are in place to protect you and protect people. So if you choose to break them and it comes to our attention, you can be guaranteed we will be there and we will issue a fine if that's appropriate. So again, just that final thing, adhere to the law, stick to the regulations, wear your face mask, and let's hope that we can come out of this in a much better place in a couple of weeks' time.
Thank you very much, Elliot, and we all endorse those views, definitely. It's just a team effort. I say it time and time again. We're all in this together. It's not us against the police or the police against people. We're all in this together, and the police are doing a very good job of helping to keep us all safe. So thank you from all of us, I'm sure, for that. Thank you, Elliot. I'm going to bring in Becky Bradshaw now from the University of Northamptonshire. But just before that, we're just reiterating that, we can't be complacent about taking COVID-19 home with us. We have to keep that in the back of our minds with everything that we do at this current time. And also, before Becky speaks, I just wanted to say that our university has been pretty exemplary compared to others. that elsewhere in the country, and I think our students have behaved in a pretty impeccable manner and need to be commended for that, as do the people who have worked very hard at the university to make sure that the students are safe and reasonably happy, I think, under the circumstances. So I'll hand over to Becky now. Hi, Becky. Good afternoon.
Hi, Councillor Morris. Thank you very much, and good afternoon to everybody. I just want to use this opportunity really to give a bit of an update on the testing programme that I gave a bit of an update on last week. So I am pleased to announce that the University of Northampton will be offering asymptomatic testing using the lateral flow test devices that we've already spoken about previously, to assist our students in getting home safely at or for Christmas. Our test site is now mobilised at our Waterside campus down on Bedford Road, and appointments are open for booking. The appointment schedule went live yesterday, and we've already got this really good interest in those test slots that are available. The testing programme will run between the 30th of November and the 9th of December. So the 9th of December is the end of the student travel window, which will enable anybody that obviously does test positive to isolate and still be home in time to enjoy Christmas with their loved ones. The programme is open to all university students that are living in university accommodation, so on-site accommodation, but also those that are living in the private sector in Northamptonshire. And we really are trying to make sure that as many students as possible participate in the programme. While it's voluntary, like I say, we are asking that as many people as possible take part, to increase their chance of getting home in time with a reduced risk of infecting their loved ones, obviously when they do return home. I think finally, I just want to add that if you are a parent, a family member, or a loved one of one of our students, that you do just encourage them to take part in the asymptomatic testing programme that we're offering. It's quick, so we're hoping to get students in and out within a sort of 20 to 30 minute window, probably less than that once we get sort of really familiar with what we're doing. So it's quick, it's easy, and above all, it reduces the risk of students bringing home the virus back to you over the Christmas period. So really, it's just a call to say if you can, please do take part in the testing programme, and we will no doubt update you again on the plans that we'll have for the new year when students then return.
Thank you very much, Becky. Thank you very much. And again, I just wanted to thank you and your team for the marvellous work that you've done to get this all in place. It really is impressive to see. Thank you for all your hard work. I'm going to come now to Councillor Jonathan Nunn. Jonathan.
Yeah, thank you, Ian. Thank you very much indeed. Good afternoon, everybody. I think it's really disappointing that we've overtaken the national average, of course, isn't it? That's quite something. We were there before people in Northampton responded, but it's really, really sad to me to see us back there. I take some, it's too early to say, isn't it? But to see that potentially is that line flattening, maybe even coming down. I guess it's inevitable with lockdown that it will, but it's far too early to say, and it's not plummeting down. We've still got seriously high rates. There are far too many people suffering from this rotten virus, far too many people carrying it around and taking it home, and far too many people living under the threat of it. So the time now is for us to ask the people of Northampton and Northamptonshire, once again, show us what you've done before and do it again. We've really got to have a good push on all of the basic things that people have already mentioned. We're mentioning particularly today about the over 60s because of the numbers there. If you do come into contact, try and avoid the over 60s, or indeed if you have to come into contact with them because of caring responsibilities, try and avoid contact with other people. You've really, really got to take that seriously. We know that you should get your flu jab if you've been contacted, but wait otherwise. All in all, we just can't get complacent about coronavirus, COVID-19. We really can't. And we know that we'll potentially come out of lockdown. We wait and see what will happen on the 2nd of December. We do know, we learned today that the government intends to strengthen the enforcement powers for local authorities. We've heard that at the Borough. That would allow our enforcement to be even stronger, and we welcome that, because I get asked by so many people, what are you doing about those people or those businesses who aren't keeping us safe? So we welcome any increase in that enforcement, and we give people a promise that we'll do everything we can to make the town as safe as possible. So we'll use those extended powers when we get the fuller details from early December, as much as we possibly can. But I think then that causes us to look ahead and to think about Christmas. And I think I mentioned last week, maybe the week before, Christmas is coming. We're all thinking about that. And let's be honest, if there ever was a year where we all desperately feel we deserve and we want the opportunity to get together with family and loved ones who we've not been able to see this year, well, this year would be the one, wouldn't it? We don't know what's going to happen at Christmas, and actually that'll be down to the government. That won't be any sort of local decision. What we do know is when we take tougher precautions, we tend to get on top of this virus. We saw that previously in Northamptonshire, when we came down below the national average. We've crept back up again. If we can see any flattening out at the moment, and I'm really cautious to say that's what's happening, but there may be a start of that. Clearly it's because of the lockdown. What we do know is when we come out of lockdown, it spreads like billy-o. And of course, you know, Christmas maybe is a time when we do things and regret them for months. Maybe that's overindulgence. On this occasion, though, actually it's more about the fact if we come together, that could have a serious impact on this virus. So I just personally don't know what I think. I don't know whether I think we desperately need that Christmas. We do, of course, but I'm really quite concerned about the fact that we take the foot off the gas. We all get together at Christmas and see ourselves in an even deeper situation in the early part of the year. Wouldn't that be absolutely awful? So the advice from us is to do everything you possibly can. The virus hasn't gone away, and do be careful. And perhaps to those who've asked questions, we've had questions from Ben and Michael at Northants Live and from Carly at the Chronicle, I think, about Chronicle Echo about Christmas. We can't say at the moment. We can't say what the right thing is, and actually the government will make the decision. What we can say to those people who desperately want a Christmas is that now is the time to do it, because individual actions affected. Follow every single precaution. Be as careful as you possibly can. And let's hope we can start to see that graph come down more and more and more. Thank you, Ian.
Thank you very much, Jonathan. And you make, as always, some very good points there. I'm going to now move to the questions that were submitted in advance by our friends from the press. As Jonathan alluded, we feel we've probably already covered off the Christmas point, because unfortunately the guidance isn't really there yet, and we've still got some work to do in Northamptonshire to get our infection rates down before anyone can be certain of anything. So I'm going to come to Ben Waldron and Michael Pearson, but if we would please go to your question to Elliot Foskett, Superintendent Elliot Foskett, around COVID-19 rules, please. Are you there?
Yes, hello. Thank you all for your time this afternoon, as always. So as you mentioned, a couple of questions for the police. Firstly, you kind of alluded to this before, but do you think people in Northamptonshire have been more compliant with the rules during this second lockdown as opposed to the first time around? Then also, I've seen this comment countless times on social media recently, but what would be your response to people suggesting that officers need to concentrate on real crimes as opposed to dealing with those breaching COVID rules?
Thank you. Yeah, I'm happy to take those. First of all, your first question in relation to compliance. Yeah, I think, as I said earlier on, generally we've seen a lot of compliance. People want to comply. They want to do their bit, and we saw that in the first lockdown. That hasn't changed for the second lockdown. I think the difference we've seen this time is actually the lockdown's different. The restrictions are slightly different. There are less restrictions on things like schools, so people going on school runs, etc. So you'd expect to see a few more people out and about. So visibly, it looks busier. But as I said at the start of this, you will notice when you walk into shops, pretty much everybody now has a face mask on, and it's the exception where people don't wear them. I did say we've seen around about a 25% reduction in traffic generally across the county, and that includes at peak times too, which is a very good thing. And I think, as I said, really, there's probably people who continue to be frustrated, and there will be people who, no matter what we do and what message Public Health, Lucy and others put out there, will just just disregard it, and they will continue to flout the legislation and the rules. And as far as the police are concerned, if you're going to do that and you're going to put the safety of other people at risk, then you can expect that we will be knocking on your door or pulling you over in your car or issuing you with a fine. So yeah, generally better compliance the same really, but expect that you'll be getting a fine if you disregard it. In relation to your second question, and I'd mulled this one over because this is something that I think every police officer hears at some point in their career. If they pull over a car or stop and talk to somebody, you'll always get the, why aren't you out there catching real criminals? Well, I think there's a couple of things. First of all, 501 people, I think, died in the UK or in England yesterday. And I don't think for 1 minute the public wouldn't expect us to play a leading role with our partners in public health in helping to reduce that. If there's something that we can do as a service, you would expect the police to be there helping our partners, and that's what we're doing. So 500 people a day are going to die as a result of this, then clearly there's a role for us in that. And as I've said, if you choose to break the law, then you can expect to attract our attention and we'll deal with it accordingly. And this is a matter of public safety at the end of the day, isn't it? It's a global health emergency. So I see it as one of our priorities. And don't forget, as I said, it is the law. You know, you are breaking the law. You are technically committing a crime if you decide to go and do this. And, you know, albeit we'll deal with it in a summary way rather than through a Crown Court, but we still deal with it. So, and then finally, I guess, is don't forget, as I said last week, we've put on additional resources. There are no more cops. There's no more police officers. We've got what we've got. So we use people on overtime. We change shifts around, etc. But we do have additional resources dealing simply with COVID breaches, with reports of breaches of the regulations. That means we've still got the same number of officers, PCSOs, police staff, detectives out there dealing with other serious crime, keeping people safe, and doing what you'd expect us to do, and that's preserving life. So I hope that's answered the question.
Thank you very much, Elliot. I think that was a very good answer. And if we all obey the guidance and the rules, then we won't need the police to step in and help out with the enforcement. So thank you for that, Elliot. And thank you for your question, Ben. I'm going to come on to Kevin Nichols now from the Chronicle and Echo. Kevin, how are you?
I'm very cold, Ian. Thank you for asking. From anything else.
You're not outside, I hope.
No, just in the conservatory, just a bit chilly. Yeah, I'd just like to ask about schools. We have the percentage figures I noticed on the slides that Lucy Whiteman kindly showed us. I think 85% of children are now at school. I just wonder if it's possible to put an actual number on that rather than a percentage, and also give us an indication of how many teachers are being affected as well.
Thank you, Kevin. Actually, I'm going to bring in Paul Andrews from our education cell at the county to answer that, if that's okay, because Lucy is knowledgeable in all areas, but he is the avowed expert in this particular field. So
that's very good of you. Thank you.
Thank you, Councillor Morris. Good afternoon, everyone. Thank you for your question, Kevin. I'm not trying to dodge this in any way, but I'll just read something that I've written down because it's quite, to a degree, a technical response to this. So the data we use to report to you comes from returns that schools submit to the Department for Education, to the DfE, and they do that each day. And one of the issues with this is schools aren't obliged to do this, and then they're not obliged to send us any information either. So although the return rates for Northamptonshire for this data is very good, they're not complete data sets. So if we gave you anything but a percentage, the figure would be inaccurate, and the percentage figure is a much better measure for you to go on. So just to support you in trying to get to what you're getting at, I think I've had some discussions with people today, and we will try and present trend data for you for both teaching staff and for pupils. And we've got that data from the 2nd of November when the DfE data return changed. And we'll bring that to the meeting. We'll get it in the slide pack for next week, so that actually you can see the trend data of how both teaching staff and pupils are being impacted by COVID in schools. Just to sort of give you some meat on the bone of where we are at the moment, in the last few weeks, it's been a difficult month, I think, or a difficult, this month has been difficult. And we've seen, I think I alluded to this last week, that there's been a gradual rise in case numbers. When I looked at the DfE data today, which is data from yesterday, the peak seemed to have been 2 days ago on the 17th, or 3 days ago on the 17th, excuse me. And we seem to have just come off of the peak now, which is really, really positive, I think. But that's only going to be sustained if, as everyone else has said, we stick to the rules around social distancing, we stick to the wearing of face masks. And I think I'd encourage parents especially, it's really, really difficult, I know, with children and young people, to help them to understand why they can do one thing in one place and not another thing in another place. Why can I see my friends in school but not outside of school? And the simple answer is because we need to limit the number of contacts people have every day. And I think it's really important that parents support children and young people to understand this. Otherwise, we aren't going to get a grip on this. And actually, schools will continue to be impacted. Children and young people will continue to miss education. And that's a real, real shame, because that's going to impact them for the rest of their lives if we're not able to catch them up. Is that okay, Kevin?
Yeah, that's fantastic, Paul. Thank you. But just, I mean, obviously you say it's very complicated, and just to say 85% of whatever the school population is aren't in school would be wrong, as you say. But do you think that perhaps the lack of information on this is affecting people going to school when perhaps they shouldn't do?
I'm a bit unsure of what you mean. So,
well, if people don't necessarily know that there's been a case in their school because it's been in another year group, some schools aren't telling parents that. I just wonder if people are going to school when they may have symptoms that could be COVID, could not getting a test because they think their school hasn't been affected.
I'm a bit nonplussed by that, just on the basis that if you suspect, I think we've always been very clear, and the guidance is very clear, that if you suspect you've got COVID, you shouldn't go to school. So the two issues for me seem unrelated. I completely accept that schools will do things in different ways. For example, a small primary school may tell the whole school that there's been a positive case in the staff group or amongst children and young people, whereas a big secondary school may only tell the year group that's been affected and won't necessarily tell all parents because they won't feel that's necessary. And that is actually a decision for the school, and certainly not a decision that I would wish to take on at a local authority level, because it's the head teachers or the principals of settings which know their schools best and are in the best position to judge that.
That's great. Thank you for that, Paul.
Thank you. And Lucy, I think you were indicating to come in, but did you still want to come in on that? I do apologise. My dog's decided to bark in the background, so I'll bring you in, Lucy, and then mute myself very quickly.
No, I think Paul said everything. It was just, we've undergone significant risk assessment work with each of the schools, which obviously is very dependent on the structure of the building, on the availability of staff, on the vulnerability of the children that attend. And it absolutely is at the head teacher's discretion as to how they apply that risk assessment that we've been assured by under the circumstances. They obviously have our team to be able to get advice and guidance from, as well as Public Health England, who are the first port of call for outbreaks at schools. But at the moment, Paul and I and PHE have no concerns about the decision-making processes locally, and each teacher is making a decision based on their circumstances, and we've found that none of those have been inappropriate to date.
Thank you very much, Lucy, and thank you for your question, Kevin, as always. I'm going to come on now. Carly had a question, but I think we've already covered that, to be honest. If you wanted to ask a subsequent question, Carly, if you wanted to put your hand up, although we are running at short of time, I think, shortly. So we're going to crack on with Jack Duggan. Hi, Jack, are you there?
Yeah.
Hi, Jack. Good afternoon.
Good afternoon. Obviously, think about flu jabs you covered, so I won't ask about that. It's more, I may ask just to Jonathan Nunn, sort of how concerned you are about the impacts on the nighttime economy if things are so restricted around Christmas that people rely on like pubs and Christmas parties and people getting their hair done for parties and gifts and all that sort of thing. Just wondering what your thoughts are sort of going into that period.
Thank you, Jack. I'll bring in Jonathan first, then Elliot, if I may, because that's a sort of two-part question, really. So Jonathan first. Thank you, Jonathan.
Yeah, thank you, Ian, and thanks, Jack, for the question. Yeah, the answer has to be enormously concerned, of course. So many retailers and hospitality businesses, they make a huge proportion of their money to keep them going throughout the year in the run-up to Christmas, don't they, really? So naturally, that economic impact is huge, and we're back to that thing we've talked about before, where we're balancing public health and preservation of life with people's liberty and with the economy and keeping people in jobs. But and so that's absolutely awful, really. And the sooner we can get them back open, but get them open safely, the better. And quite rightly, at the moment, it does seem that the right thing is, with the spread of the virus, that they are closed. So I'm supportive of the fact that we've got only essential things open and we haven't got pubs and bars, but I completely feel the pain that those businesses are suffering. The most awful time, and these are people who put every ounce of their life and their being into their local business in Northampton or wherever else it might be. So that's really awful. I can actually perhaps just use that opportunity to say that obviously we've been familiar that the government have launched some further business grants. They're much more modest than they were before, and they relate to business property costs largely. The first range of those, it's certainly in Northampton, the portal's gone live. I think we've had a couple of hundred applications in the last day or so, and we've paid about 60, 70 or more grants straight out. It's a smooth process because we've dealt with people before on the first lockdown. So we would just take the opportunity to encourage all businesses with property costs to quickly get an application in, and there will be further grant schemes coming along. But I mean, the overall thing is seriously concerned on the impact for businesses, seriously concerned on the impact for people who might normally be starting to celebrate now and are just finding it a slightly depressing time with the colder weather and the dark nights and so on. But we've just got to do it to keep people safe. It's a rotten, rotten shame.
Thank you very much, Jonathan. I'll bring in Elliot now. Elliot.
Yeah, I think from a policing point of view, as you would expect, Christmas doesn't take us by surprise. We plan for it in advance. Clearly, we don't understand what the regulations are going to be at the moment, what level of restriction there will be in place. But as and when we do understand that, we will have the right level of resources out and about to deal with it and to keep people safe. And I think I would just say really that, we're not the fun police. That's not our job, is to police people's fun. We are here to keep people safe. If there is a temptation for people to break the law, to have parties at home, for example, when that may be against the regulations, you can expect that there are some pretty hefty fines involved in that. And again, recognizing what Jonathan was saying there, I absolutely understand the impact of this on the local economy. But folks, those people who may wish to contravene the law at the moment and decide to have lock-ins or whatever it is as a legal thing, we will deal with it. We dealt with one earlier on in the week where a licensee is now going to be going to court. We've dealt with the joint enforcement team, which I spoke about a week or two ago, has today been out and about and been called to, again, a lock-in at a licensed premises, which I won't discuss any further at the moment, but the licensee for that has been issued with a summons, or will be issued with a summons now reported, and those people in attendance will be given fines too. The regulations are there to protect you. As soon as they start to ease, as soon as we start to see a lifting of that, then the police will police it accordingly. But at the moment, that's what we're here to do.
Thank you very much, Elliot, and thank you for the question, Jack. I am going to move on because I'm conscious of time. Apologies for speeding up a little bit, but we're trying to get done as near at 4, as close to 4 as we can. So I've got Neil Barber next. Neil, hi, sir.
Hi, just a couple of questions, one for Lucy and one for Becky Bradshaw, if that's okay. Lucy, we've been on the streets of Northampton today asking people kind of why they were out, what they were doing. On several occasions, we were told things like, I'm out shopping, I'm doing my Christmas shopping. In one instance, we actually met a mum who was out with her child who she'd kept off school for no other reason than he wanted a day off. How dangerous is that behaviour given the picture you've just painted? And to Becky, you mentioned about encouraging parents of students to ask their kids to get tested before they come back. What happens if they don't?
Thank you. Very, very good questions there, Neil. Thank you for those. I'll come to Lucy first, then Becky. Lucy.
Thank you, and thank you for the question. I mean, I don't think I could have articulated it any better than Superintendent Foskett did earlier. Fundamentally, this is a crime. And the reason that the legislation has come in and the lockdown is being enforced at the moment is because if you move around for unnecessary reasons, you pose a risk to other people's lives. It is that simple. And we are seeing that, pattern, sadly, in the deaths locally, where we are seeing more community transmission. While people continue to go out for reasons that are not required, we are seeing more deaths. I can't put it more simply than that. It is a crime. You are putting people at risk, and you need to be taking responsibility for those actions. And where you are found to be deviating from the law at this point in time, the police will deal with you accordingly.
Thank you, Lucy. And I think we would all agree with that. It is pretty stark, but it's very, very sound advice, that. Becky, over to you, Becky.
Thank you for the question, Neil. I suppose a bit of a similar answer to that from Lucy's, really. So the programme that we'll be offering is voluntary. I obviously mentioned that in my update, and we're aware that not everybody will decide to participate. But by not doing so, our students run the risk, obviously, of taking that virus back home to their families, and then passing the virus onto their loved ones. Really, that, I suppose, if you're asking what is the consequence of a student not taking part, that is the potential consequence. We won't be taking disciplinary action, for example. Like I said, it's completely voluntary, but our students do run the risk of passing it on to their loved ones, and potentially then obviously that meaning that their loved ones end up very, very ill, or worse. So that is in the communication that we've sent to our students, and really trying to make sure that they're as informed as possible when they're making that choice to go home.
Thank you very much, Becky, and thank you for that question, Neil. We've probably got time for a couple more, I think. So yes, we've got a couple of minutes left. So Stuart, I know, Kevin, you've got your hand up as well, but I'm going to come to Stuart Ratcliffe because he hasn't had the chance to answer a question yet. And I know Laura's hand's just gone up, but we'll see how we go for time. Stuart.
Hi, thanks very much for that. I just wanted to ask, there's been a lot in the national media over the last few days about preparations for a COVID vaccine rollout and sports halls being set aside. I just wondered what preparations were taking place here in Northamptonshire for any possible COVID rollout of a vaccine.
Thank you very much, Stuart. Shall I come to Lucy on that one? Lucy, would you want to take that one, or would Joe want to say something about that? It's a sort of two-hander, I think. We'll go to Lucy and then Joe, maybe. Lucy.
Hi, thanks. Yes, so it's a huge operational challenge, as I'm sure you can appreciate. We've never rolled something out at scale like this before. So we've got a big multidisciplinary team working on the plans for the rollout of COVID vaccination. And at the moment, we've sort of got a four-prong approach in development, which includes delivery through our GPs. It includes a home visiting service. It includes mass testing, mass vaccination centres, and a number of other sort of community settings. So we're trying to make sure that we can reach as far into the communities as possible to offer them the opportunity for the vaccination as and when it becomes available. We're standing up the service to be ready from the beginning of December in preparation for vaccine availability, but obviously we've still got a lot of details to come through with regard to the actual timings of that. There are significant challenges. I'm sure Joe can add some detail, but logistics from a point of view of storage, particularly for some of the vaccines at significant sub-zero temperatures, the shelf life of the vaccine once it's actually mixed up and ready to be actually utilised, including obviously all of the actual invitation process and the recall process, because this is a two vaccine schedule where they're either 21 or 28 days apart, dependent on the vaccination itself, is highly complex. But I can assure you we've got a significant team with various experiences working on this, and we're obviously working alongside regional support to ensure that we've got everything ready as and when the vaccine indeed becomes available. Joe, I'm sure there's detail you would want to add to that as one of our lead GPs.
Joe.
Yeah, so I think it's fair to say that we are hopeful that the vaccination is going to make a difference, will allow us to get back to normal, and it is going through all the proper safety testing processes, and actually it's looking pretty good from that point of view. It is huge, but it needs to be huge to deal with a problem of this size. There are going to be lots of logistics, and again, it's going to be one of those situations where people are called in batches. So as long as you are registered with a GP, you will be called when you are ready to be vaccinated. What we are urging people to do is to get, if you are eligible for flu vaccination, get that done now, because there may be a gap that people are required to have between their flu jab and their COVID vaccination. So you might as well get your flu jab done and out of the way now. But the COVID vaccination, I think, is very exciting. It's very important. It is a big deal, but it is what we need to make a difference and get ourselves back to normal. And it has gone through all of the proper testing processes as well. There will be a lot more information for people available when they're invited. They will be given huge amounts of information. And I think the other thing to say is that this is everybody working together as a system. So we're really pleased when we put out a request for volunteers for people who are working at the Community and Mental Health Trust, working at the Acute Trust. We've had loads of volunteers from clinicians and non-clinicians. This is about everybody working together, playing different roles, not just doctors and nurses jabbing people, but people who are runners, people who are security guards. This is everybody who is going to work together to make sure that our population is protected, and it is going to be a huge effort, but we will get there.
Thank you, Joe. Lucy, did you?
May I just add one more thing? I think that the one thing that Joe and I would both stress, though, is that it isn't a silver bullet. It is going to take a number of months for us to get through the eligible population to fully vaccinate and to start to really feel like we're in a position where we can start to regain some of that normality. We cannot afford for our infection rates to go up in the interim. So, it does not negate the need for people to be as conscientious, if not more so, all the way through, even when the vaccination schedule starts. So hand, space and space remain our key defence, and right and through our vaccination programme, right to the end until we have reached some sort of normality again. I can't stress that enough.
Absolutely, and I think we'd all agree with that. And just because we're planning for a vaccine, technically there isn't one yet as well. So again, I reiterate the need to follow the guidance and the rules, as Lucy has just said, until such time as we are absolutely certain. And even beyond that, until the rollout is completed, it's going to be really key. And people can't take their foot off the brake, if you see what I mean, or they've got to carry on doing this. And it's a big ask, but it's something that we have to do. I think I've got one chance for one more. I know we've slightly over, but I noticed that Laura Coffey is on the line. And Laura, you haven't had a chance to answer a question yet, whereas Kevin has asked several. So Laura, please. Hi, good afternoon.
Hi, good afternoon, Councillor Morris. So I had one of my written questions that I'd like to put forward, which was about the lateral flow tests. And I know that we heard yesterday in the COVID board meeting that Northamptonshire has been added to the government list of places that will be receiving them. Earlier this week, some scientists raised concerns about the rapid testing, saying it will fail miserably. Are you cautious about the benefits? And then I just had a couple of questions for Deborah Needham, please. I just wanted to clarify on the number of patients with COVID across the hospitals. So last week you said 116, or last week it was said that there were 116 patients across the 2 hospital sites. This week 133. Is it simply then 17 more, or is it not quite that simple? If you can just clarify that. And also, what impact are pressures seen at other hospitals around the country causing on hospitals in our county? And can you confirm which outpatient clinics have been cancelled? You mentioned that a number, particularly at NGH, had to be cancelled. Which ones were they? Thank you.
Thank you, Laura, for the one question that turned into 5 there, but we're used to that, don't worry. I'm going to come to Lucy first, and then we'll go to Deborah if she's still on the line, which I think she is for the second part, or 2 or 3 bits at the end there. Thank you, Lucy.
Hi, thanks, Laura. So lateral flow testing, again, it's, as I can't stress enough, it's one of the very many things that we need in our toolbox to beat COVID. it has an opportunity, and so I'm cautiously optimistic that it can add value. But again, it is not the be all and end all, and it needs to be used alongside a number of other measures. But it does provide us with an opportunity to explore the ability for things like care home testing, so that people could potentially visit in care homes, for us to respond much more rapidly to outbreaks. And as I said, it doesn't replace the need for PCR testing in certain circumstances at the moment, for our normal infection prevention and control measures, and for everybody to continue to obviously work really hard to create COVID secure environments. But it is, again, just a step forward in trying to give us more accurate and timely picture of the current situation, be that in a setting, in a larger area or other. Obviously, we await the results of the trial in Liverpool, which is the first one at a significant scale. You know, they are struggling logistically to deliver testing to the whole population. And as I said, you know, please don't underestimate the challenge that and mass vaccination will be locally either. But I do think that they will potentially add value in certain areas. And so we'll be going out with small scale options at first to see what that does and how that affects our ability to sort of move forward and take positive steps. If indeed we have any concerns about it, we will stop.
Thank you, Lucy. I mean, it is exciting. It's an exciting development, but one that we wait and watch elsewhere and see how it unfolds here, as you say. Deborah. Hi, Deborah.
Hi, thank you. I'll be very brief because of the time. So in terms of the patient numbers, 133 today. 133. That's not quite as easy as saying 17 more admissions, because of course some of last week's will have been discharged. So I can't give you the exact number that's new at the moment. With regards to outpatient clinics, these are routine outpatient clinics, so they're not for patients with potential cancer or any urgent requirements. And with regards to other hospitals in the region, everywhere is really busy. I think one of your earlier questions was around critical care. We are part of a critical care network within the region. What this means is that we regularly provide mutual support across the different hospitals, and we have got capacity in our critical care, so we would respond to those requests as they come in, like other hospitals would to us if we're in need. Thank you.
Very much, and thank you for those questions, Laura. Of course, we're always open to questions at any time outside of this arena as well. So if we don't answer any questions, as it were, live in the press conference, and I'm sure you do this anyway, please keep those questions coming. It's really important, the engagement with the press, to get this messaging over. I'm afraid, Kevin, I know your hand is up, but we are slightly over, and I will get my knuckles wrapped for going too much further. So what I'm going to propose is that we close the meeting now. Thank you very much for the members of the press for attending today, for their questions. Thank you, as always, to the panel and for all their brilliant answers. There's some key messages that we have to take away from this. We've got to protect the over 60s and make sure that we don't take COVID-19 home with us. And for those that are over 65 that are already booked for a flu jab, please make sure you go and have your flu jab. And on that note, I'd say have a lovely weekend, everyone. Thank you for your time. Stay safe, stay well. Together we can beat this virus if we follow the guidance and the rules. Have a lovely day.
Thank you.